All right, so our group subject is on homelessness in Maine. Each of us will go over a different perspective on the problem. I will go over the situation from an objective outlook. Levi will be delving into the concept of poverty. Anna will be telling us about the event that was the opioid crisis. And Michael will be talking about the steps being taken to fix the problem. So according to the Maine Housing Program, approximately 7,000 people are currently homeless in the state of Maine. The majority of these people are single adults, 80% of which experience extreme poverty. Now, in this scenario, we'll define extreme poverty as making less than $25,000 annually per household. According to the National Low Income Housing Coalition, Maine has one of the top 10 highest living costs in the country. An average two-bedroom rental home costs $41,000 annually. 60% of the current renters experience severe cost burdens. And even so, there is still a very high demand for affordable rentals. Based on this information, we can tell living costs play a big part in causing homelessness in Maine. But what other factors contribute to this? Now, one of the more obvious causes would be unemployment. According to a survey conducted by the Maine Housing Organization, over 30% of the homeless population were unable to find work and couldn't pay their bills. Now, this statistic does not depend on education level, as over 70% have completed some high school, obtained their diploma, or had some college education. The unemployment rate in Maine has risen to 6% from 3% between September 2019 and September 2020. This increase can partially be attributed to the COVID-19 pandemic, which impacted the economy and workforce worldwide. With this in mind, currently in Maine, there is a high demand for skilled laborers, but being homeless can make it very difficult to actively search for a job. Luckily, many of the shelter programs in Maine are working towards training those they shelter to re-enter the workforce. The Preble Street organization is one of the most notable in helping the homeless in Maine, especially veterans, find jobs with success stories following their efforts. One such success story is covered by Goodwill Northern New England on how Michael Waldo, a Maine veteran who was both homeless and unemployed, is now employed and in a stable home. For this to happen, he contacted a career assistant, was referred to Preble Street, and from there was enrolled as an oil burner technician trainee. Soon after starting his new job, he was able to find an apartment with some help from the Goodwill Veterans Fund. Programs like these are essential to helping people like Michael get back on their feet. And as their reach increases, so will the number of people they can help. Another of the leading causes for homelessness in Maine is substance abuse and mental illness. According to Maine Housing, nearly 40% of all homeless people in Maine suffer from mental illness and substance abuse. These two factors coincide, as mental illness can lead into substance abuse. An individual's mental illness can impair one's ability to socialize and function in society. This leads to the individual having a difficult time holding down a job, which will eventually leave them without a home. Most times, substance abuse will accelerate this process, negatively impacting the individual continuously. There are organizations associated with Maine shelters that are actively working to help people that suffer from substance abuse. However, receiving this help requires the initial request, which is very difficult for most people. Furthermore, people who are alone are less likely to seek out help, especially depending on the severity of their illness. Now, this situation might sound a little hopeless, but luckily, there are many people currently working to help the homeless in Maine. Over 90% of the homeless people are able to find refuge in shelters across Maine, and as we discussed earlier, there are programs working to help them re-enter society. With that in mind, it is important to recognize this population's struggle, and that without help from the rest of us, this situation cannot improve.
The late Mahatma Gandhi once said that poverty is the worst form of violence. What Gandhi meant by this was not that poverty causes the most death or is physically violent in itself. What Gandhi meant by this is that poverty causes immense suffering and despair, which in reality is the worst form of violence to stand by and witness. Now, I have a feeling neither myself nor the people listening have encountered poverty and homelessness firsthand. Therefore, not many of us understand the concept personally. That being said, we all know those heavy, unbearable feelings of suffering, stress, and hopelessness. Now, take those problems and magnify them to the level of not having a steady income, not having food on the table, not even having a home. Poverty and homelessness on paper mean different things. However, I'm here today to enlighten you on the idea that poverty is a fast track to homelessness. Not everyone who lives in poverty is homeless. However, poverty significantly contributes to the homeless population in our country and throughout the world. Now, I bet a lot of you don't know what poverty really is. Well, what it is not having enough material possessions or income for a person's basic needs. Many of us can claim that we're broke and we don't have that much money, but in poverty, those are the people who can factually claim to be broke because of their lack of necessities that many of us take for granted. It's just food, water, a bed, a bathroom and shower, and other necessities that we use daily. According to a Live Stories catalog taken in New York in 2018, the federal poverty income threshold was $25,000 for a family of 4 with 2 children and $17,000 for a single parent of 1 child. $17,000 to do and contribute to everything that we deem essential is not that much money. And if a family's total income is less than the corresponding threshold, then that family and every individual in it is considered in poverty. According to the same study, just shy of 10,000 people live in poverty across all age groups in Maine, which seems like a relatively low number, but if there's anything we've learned, especially through the pandemic, is that 1 person is too many for this problem. Now that you have a better base understanding of poverty, it should be noted that homelessness is the most extreme form of poverty. Poverty can induce heavy trauma and stress into a person's life, which can lead to shelter loss. Everyone experiences trauma and stress at one point in their life. Now just imagine those problems magnified and intensified so greatly that you feel to a point where your life is spiraling out of control like a snowball that is tumbling down a cliff. Now, respectively, a lot of people that are homeless or in poverty can be linked, in some cases, with low education levels. Through a life-wise study, over a third of the poverty population has only attained a high school diploma or lower for their highest form of education. Education can't be the sole reason to blame. We also have evidence based on the Independent, which is out of Utah, that claims quote, within the United States, a person may be living in poverty because he is mentally or physically challenged and therefore is unable to obtain or even keep a job, a minimal level job. Many may be literally trapped in a situation where their livelihoods have disappeared, end quote. In extreme cases, this does lead to homelessness, as I've previously stated. Clearly, we have established a connection between poverty and homelessness. We will now examine the ways which one can avoid falling into poverty or becoming homeless. Poverty and homelessness can be avoided. And while some people do have those extreme cases, it makes it difficult to avoid. The everyday working citizen should be able to avoid poverty and homelessness. College education sounds like a great way to avoid it. However, committing to a post-secondary education while accumulating a lot of debt and that your salary cannot efficiently pay off in time will also cause poverty. In some extreme cases, can cause homelessness. Again, from the Independent, it is very apparent in today's world, lots of jobs that used to be simple, not require a lot of education, provide acceptable salaries are disappearing rapidly. It is true that decent paying jobs and careers with benefits in manufacturing and production especially have decreased significantly. Many of these industries have been outsourced to a lot of other countries and simply disappeared. The condition has severely affected the middle class, and the service level jobs have increased. That's a good thing, but the pay is significantly less and many are minimum wage level jobs, and that's end of the quote. The bottom line is that higher education is a great tool, an opportunity to maximize your career and what you make for money. However, it's important to not bite off more than you can chew and to pay off your debt responsibly and effectively. I'd like to close this idea with poverty may be the far pressing issue globally as it affects more people than homelessness, but I believe that not having a home is the more alarming issue at hand for society. This is why we must realize the relationship between poverty and homelessness so we can prevent as many people as we can from falling into these unfortunate situations.
According to the Maine Department of Health and Human Services, 1 in 10 homeless youth in Maine have used heroin at least once in their lifetime. My purpose today is to discuss the relationship between homelessness and opioid use in the United States, specifically in Maine. While I have no personal experience with homelessness, I've witnessed firsthand how opioid addiction can ruin lives. It's important to understand the implications that homelessness has on the opioid epidemic and vice versa, seeing how prevalent of an issue this is in Maine and the United States. Today, I will overview the opioid epidemic, discuss how this relates to homelessness, and what needs to be done to lessen this issue. The opioid epidemic is a serious problem in Maine and the United States. According to the National Institute on Drug Abuse, every day in the United States, 128 people die from overdosing on opioids. In the 1990s, opioids began being prescribed at greater rates because pharmaceutical companies assured doctors the risk of addiction was small with prescription use. However, it is now known that they are a highly addictive drug and should be prescribed with caution. About 29% of people prescribed opioids will misuse them. In Maine, opioids are prescribed at a rate of 48.1 for every 100 people. According to an article written last year by Christopher Burns at the Bangor Daily News, between 2006 to 2012, more painkillers were prescribed on average per person in Penobscot County than any other county in New England at a rate of 56 pain pills per person. The homeless population is especially vulnerable to the opioid epidemic. According to the National Healthcare for the Homeless Council, homelessness has been shown to negatively affect both physical and behavioral health. This makes the population more susceptible to opioid use, and once they are addicted, it can prolong homelessness and affect their ability to receive proper treatment. Unfortunately, homeless individuals who use opioids are 9 times more likely to die from an overdose than those who have stable housing. This is a serious problem, and it is important to understand what we can do to help. An important first step is to remove the stigma surrounding addiction and realize that opioid use disorder is a mental health disease. Another important step is to regulate the rate that opioids are being prescribed. This is because 4 out of 5 people who misuse heroin started by misusing prescription painkillers, according to the American Society of Addiction Medicine. It is also important that users within the homeless population have the support that they need. This can be achieved through more accessible recovery housing for homeless users. In conclusion, opioid use is a serious problem that can affect anyone, especially the homeless population. After discussing the opioid epidemic, how it relates to homelessness, and what needs to be done, I hope you have a better understanding of this issue and what you can do to advocate for those who may be struggling with opioid use disorder, especially the homeless population.
As a woman by the name of Sathana Nagarjian once said, "Who are we as human beings if we ignore the suffering of others?" This quote was said by Nagarjian, and I believe that it means, as a human being, how could you see someone suffering and do nothing about it? How could you see someone in need and not act on it? A lot of these people have members of their families struggling with being homeless, and it's a really tough thing to see happen. In Maine, the amount of people that are affected due to homelessness isn't as popular as, say, California or New Zealand, but it is still an ongoing problem. The state of Maine has had a lot of proposals and a lot of ideas to decrease the number of homeless people on the streets. They have came out with different categories and different plans for each of those categories. Homelessness in Maine is a continuous problem, but there is a pretty set plan to help prevent and eliminate the amount of people that have been affected by being homeless. Maine really went into depth about tackling this problem. They had many organizations and many people come together to get this plan to perfection. In the article, Maine's plan to end and prevent homelessness, they said, this plan will be in effect until the number reaches functional zero. This shows they are very motivated to get the number of homelessness in Maine to zero, and they won't stop until it does. In their plan, they broke it down into 5 categories in the different cases of homelessness. They had single adults experiencing chronic homelessness, single adults experiencing circumstantial homelessness, families, victims of domestic violence, and unaccompanied youth. For each of these categories, they break it down and describe the specific plan for each. Some of these plans they have included case management, rental subsides, housing navigation, mental health support, etc. For unaccompanied youth, they have programs like family meditation and drop-in services. This is essential that unaccompanied youth has specific programs for them because they are still young teens, and not being brought up with the right structure could jeopardize their whole adulthood. They have many offerings and many programs to get people back on their feet and give them some guidance to turn their lives around. The staff try to push the homeless into getting a job and affordable housing for them to get off the streets. In Maine's plan to end homelessness, the staff are skilled in many different areas to help out the people with many different cases. One of the skills they listed in Maine's plan to end homelessness is that the shelter staff are skilled at engaging clients and providing support for finding housing, securing rental subsides and security deposits, and networking with general assistance, social services, unemployment services, and a bunch more, for efficient access to housing and support for stability and success in housing. With all these services and all this help from the staff from the shelter, should help a person get them on their own feet to be stable in the actual community. For the chance of returning back to the shelter and being right back in the same place, they have many wraparound services that include things like employment search, budgeting money, management skills training, representative pay services, access to social security, disability, and transportation. Most importantly, Maine is making sure people that are homeless have enough resources to get out of the place they are in. A major issue is affordable housing in Maine, but their main priority is to really focus on affordable housing and rental subsides. In the article by Rachel Ross, they are trying to suggest that a portion of coronavirus relief fund, which is $1.25 billion to Maine, be set aside for the production and establishment of supportive housing to end homelessness. This shows that Maine needs more housing, and it is a very big demand. So far, this plan has been very effective so far, but the problem is that the number is still rising and not going down. But this could be from problems like COVID that just came in effect. But Maine is striving to get more affordable housing and should be able to decrease these numbers. In Maine, homelessness is an ongoing problem. It has been for a while, but due to the set plan Maine has come up with, should decrease and eliminate the number of total homeless people, by splitting them into groups of different needs, like single adults experiencing chronic homelessness, single adults experiencing circumstantial homelessness, families, victims of domestic violence, and unaccompanied youth. This will be very useful because this will help them go into depth for each specific group and help them on their specific needs. After hearing what each of us had to say, it becomes apparent that homelessness is a problem we should be well aware of, and it isn't just in Maine. All over the world, there are people struggling to find the bare essentials that most of us probably take for granted. I hope that our words have taught you something today about this problem, and now you have a better idea of the hardships that many of us face. Thank you.